More and more people are turning to a medication called Botox to regain a more youthful appearance. But long before it became popular for reducing wrinkles, it gave patients with certain debilitating conditions a second chance at a normal life. Chris Weber explains.
For many people, simply playing the piano might not seem like a big deal. But for ANITA CROCE, it's huge. In 1980, she began to suffer uncontrollable facial spasms that would, among other things, cause her eyelids to clamp shut.
I couldn't cook. I couldn't clean house. Most of the day, I just more or less sat around. Occasionally, I could pull my eyelid open.
As her condition worsened, ANITA visited nearly 24 doctors, most of whom told her the problem was psychological. Finally, after 5 miserable years, ANITA found an ophthalmologist at Grant Medical Center who not only recognized the medical condition called benign essential blepharospasm, he also knew how to treat it.
ANITA, why don't you tell me where you had the most problem in the last couple of weeks?
Since the 1980s, ANITA has been visiting Dr. John Burns about every 8 weeks. During each visit, she receives anywhere from 25 to 30 injections of botulinum toxin type A, or Botox, which temporarily weakens the facial muscles and allows her to see.
It changed this particular patient from somebody who was felt to have a psychiatric condition, who actually had been hospitalized in a psychiatric hospital, who had to give up driving, who could not basically take care of her family, to a person who drives regularly, takes care of her family. So it has the potential to transform a person that much.
Today, the muscle weakening effect of Botox is also helping people who want to look younger. But doctors warn it's not something to be taken lightly.
Botox is wonderful for the types of facial wrinkling that are created by repeated muscle contracture. It's a really exciting advance. I think it's important to remember that this is a medication, and it should be treated with respect, and should be done by professionals who know how to use the medication.
What a difference a day makes.
For ANITA CROCE, getting rid of crow's feet and frown lines are not top priorities, but she credits Botox just the same.
It has given me a life where I know that I'm able to do all the things that I once did.
Around the time of ANITA's diagnosis, a foundation was being formed to locate and help the approximately 60,000 Americans who suffer from benign essential blepharospasm. Today, ANITA is one of 4 regional directors of this organization.